Mavube, good afternoon to you. So let's talk about the man who is concerned that his family is being plagued by the virus. Circle the story for us. What's happening?
Well, Jeremy, in fact, that man, we understand that one of the family members passed away on that Monday, suspected to have COVID-19, in fact, which is why we're back in King Williamstown now. In my hand, I have one of 4 suspension letters after nurses were suspended by the Department of Health after they refused to help that patient on Monday. Now, joining me, in fact, is a nurse that was relieving them. Obviously, his identity is asking to be kept secret at this stage, but just detailing more of what happened. Thank you for joining us at ENCA. But what exactly happened on that Monday after that shift?
Our pleasure, Mr. You know, what happened is that there have been unfairly dismissal of our workers. It's actually 4 staff members that were dismissed due to they tried to fight the way out in terms of getting a PPE, protective clothing, whereby they needed to protect themselves to go and assist within the patient that unfortunately demised. But unfortunately, within the incident, our CEO has taken the matter into her hands, and then she dismissed with a precautionary suspension of 4 in the same team, 2 professional nurses and 1 assistant nurse, with also as well a porter as well.
Just to get more understanding, why did the nurses refuse to work and help that patient who eventually passed away?
Yeah, it's been a long process because, you know what, it started a while back within the precautional measures that's supposed to be taken within the professional people that are supposed to wear. So basically it's within the PPE, the personal protective clothing. Ne? It was not enough, it was insufficient. Now they forced the nurses to go inside and assist the family, or assist the patient who unfortunately demised. But the problem now is that they didn't have the proper PPE. But according to now, what happened is that the relative now informed one of the staff members that mother has collapsed down. Can you please come and kindly assist, because we can't, she's unable to breathe and all of that. So now they took these insufficient PPEs and they were wearing plastics on the shoes. And then when in their way in, one of the relative members, I think they retaliated and said, you have this PPE, my mother is dying here, but all this time you had this PPE, whilst it was only a single gown with shoes. So one of our staff members got so touched by that matter because she was risking her life in that manner. So she returned away, and then one was going inside. But the CEO, our CEO, said and confirmed that no, they're doing nothing, these nurses. We have this PPE. It's been long that we have these PPEs. Unfortunately for her, this nurse that was waiting there to assist with these undone or unwell PPEs, with the half PPEs, then this last member turned away, this last staff member.
Okay, we'll wrap it up there, but we do understand, Jeremy, that the 4 nurses said that they won't be able to assist the patient, in fact, who later on passed away, suspected to have COVID-19, saying that they don't have sufficient PPEs, adequate PPEs, in fact, to go and attend to that patient. They've later on been suspended yesterday, and some of the letters coming in this morning. We do understand at this very moment there is a general meeting that will be taking place at Grey Hospital with some of the staff members and the CEO, just to find a resolution to this issue. We ourselves will be catching up with one of the unions now, as well as I've put out a request to the Department of Health just to give us more clarity as to what's happening.
All right, we'll get back to you a little bit later.